Chapter 13, the Endocrine System, Screencast 5. Now, this screencast is focusing on disorders and diseases of the endocrine system. The disorder that you're most familiar with is probably going to be diabetes mellitus. This is a disorder or disease related to the failure to regulate blood glucose. So now glucose cannot get into the cells where it can be used, and this results in abnormally high levels of blood glucose. So high that glucose and excess water actually appear in the urine. Now, some of the things that may happen in the poorly controlled diabetic is the abnormal metabolism of carbohydrates, proteins, and lipids, and those can be responsible for some very significant complications. You may be familiar with a state of ketoacidosis. Now, symptoms include dehydration, thirst, fatigue, frequent infections that heal poorly, blurred vision, tingling of hands and feet. Overall, a neuropathy is associated with that. Now, there are two types of diabetes, type 1 and type 2. Type 1 is when the pancreas does not produce enough insulin. This is thought to be an autoimmune disease. You may also have heard it in the past as insulin-dependent diabetes, and it is treated with hormone replacement of insulin. It could be injections, insulin pump, so on. And as I said, it's believed that type 1 diabetes is due to the autoimmune destruction of the beta cells of the pancreas. There may also be some type of genetic component or environmental trigger, but generally we might also call this previously child onset diabetes, and that's because typically the age at which someone is diagnosed with type 1 diabetes is typically during the tweens. Now, type 1 diabetes only accounts for 5 to 10% of all diabetes. The remaining are actually type 2 diabetes. This is non-insulin dependent. It's characterized by what we refer to as insulin resistance. So the cells in the body do not respond appropriately to insulin, or insulin is actually ineffective in regulating blood glucose. Generally, we see this in adults over the age of 40, but now, because of issues such as childhood obesity and things like that, there are kids out there that have type 2 diabetes. Now, as I noted before, lifestyle factors, specifically diet and exercise, play a major role in the onset of type 2 diabetes. Generally, the first way to treat type 2 diabetes is lifestyle changes. So weight loss, diet, exercise, all of those. There are also a number of medications that are used to treat type 2 diabetics. Some may be so severe where they actually will need insulin because they basically have burned out the pancreas by trying to produce insulin that's just not doing its job. This accounts for about 90 to 95% of all of the cases of diabetes that we see. Now, hypothyroidism, this is due to an underactive thyroid gland. In children, this creates what's known as cretinism, and this results in a slower body growth, alters brain development, and delays puberty. In adults, it's going to be myxedema, and so there's going to be swelling or accumulation of fluid in the interstitial spaces, lethargy, weight gain, and a low basal metabolic rate. Hyperthyroidism is the opposite. That is due to an overactive thyroid gland, and those individuals will have an increased basal metabolic rate, this nervous agitation around the time, hyperactivity, and also weight loss. Graves' disease is an autoimmune form of hyperthyroidism. Adrenal gland disorders include Addison's disease, and what this is the failure of the adrenal cortex, and generally there's a hyposecretion of cortisol and aldosterone. What this does, this lowers blood glucose and sodium. It's relatively slow to develop. Generally, there will be this chronic fatigue, weakness, abdominal pain, weight loss, and a bronzing of the skin. Now, Cushing's, this is excessive cortisol secretion. So generally excessive production of glucose from glycogen. These individuals will retain too much salt and water. There's going to be a loss of muscle mass. There's going to be a difference in fat distribution. And symptoms can also be used with some of the drugs, cortisol and cortisol-like drugs, if they're using them too often. Here we can basically see before and after, okay? Hypogonadism, this is abnormally low testosterone levels. Prior to birth, this results in ambiguous, undeveloped, or female genitalia. Prior to adolescence, this results in delayed or incomplete male sexual maturation. Adult males may result in a low sperm count, erectile dysfunction, a decreased sex drive, fatigue, and depression, and generally the treatment for this is testosterone replacement therapy.